Welcome to Billion Dollar Marketing Secrets Over Coffee with Biz Coach Steve Feld. Biz Coach Steve interviews fellow successful business owners about the strategies they have used to grow their businesses, and in turn, you can use them to help you navigate your business towards success. Ready to learn strategies to grow your business with less stress and build a long-term sustainable business to exceed your personal and business financial goals to build the business of your dreams? Well, you have come to the right place. Please welcome Biz Coach Steve Feld.
Hello, fellow business owners, and welcome to another episode of Experts Over Coffee. I'm Biz Coach Steve Feld, and my goal is to stop business owners from suffering entrepreneurial depression and start making running their businesses easier, more fun, and highly profitable to reach 7 figures and beyond. Today, we have another fantastic guest for you. We have Zev Barnett. Now, Zev, he's a serial entrepreneur and founder of Maven Hemp. It's an international provider of cannabinoid-based health therapies and medicine. We got to dig into this. Please welcome Zev.
Thank you. Thank you very much, Steve.
Great. Well, the first question I got to ask is, how did you get into this industry?
I got into the industry almost 6 years ago because I was looking for a different commodity to work in. I grew up in working in the steel business and furniture businesses that my family had and still have in the Midwest. And then later I worked on Wall Street as a trader. And I left Wall Street after 9/11. And short story, I bounced around into some different startups in the intervening years. And then I found the hemp industry, like I said, about 6 years ago. Was fascinated when I started learning about the fiber part of the business, which is very meaningful, and hemp as a protein source, and then hemp as a potential plant-based medicine. So I dove in.
So what kind of products does your company produce from hemp?
Well, we are in what I would call the wellness space, and we also call the prescribed by doctor space. So I hesitate to call them drugs, but it's definitely medicine in some respects. And because we're working internationally, we literally do make products that are distributed by pharmaceutical companies and prescribed by doctors. So we make a full range of products. We make over 100 different SKUs because we make products for other companies as well. We have a big white label business and private label business. So everything from specific products for veterinary medicine, treating animals for things like epilepsy and seizures and pain, and promoting healing in them by helping them relieve inflammation from the products. We make products for pet owners. We make products for orthopedists, for spinal issues. We make a women's sexual health line for vaginal pain, and also for dryness and other things that occur from injuries and from aging. We make a line of pain products for chiropractic offices. So once again, there's a vicious cycle of pain, sleeplessness, and anxiety, and so we make products for all 3 of those. Those are the main uses of CBD, but CBD is just one molecule out of about 165 that have been identified that are cannabinoids in the hemp plant or the cannabis plant, which are the same thing. Cannabis plants have varying levels of THC, which is the other molecule that's most widely known, and the hemp world is using low THC strains of cannabis plants, and the total THC level is under 0.5% by weight, it's actually 0.3%. And so all of our products are made under that level. And we're regulated by the Colorado Department of Health and Environment and also the Colorado Department of Agriculture to make sure we're doing the right thing. But we've delved into the higher stratosphere of product making because we are using an API version of CBD, which means active pharmaceutical ingredient, which literally means drug. So we're doing product making overseas, focusing on Latin America, and we're making products. One of the neat lines that we make is DNA matched to people. So the patients take DNA tests. The results are sent to the patients, and it indicates what proper dosing is for you in terms of cannabinoids, terpenes, which are another thing we can talk about. Those are compounds in the plant that are very much affect how your body reacts, and essential oils. And so we have 7 different formulas that are matched to different results for the DNA. And so that's keeping us busy.
Wow. It sounds like you have something for like every entrepreneur, business owner out there to relieve all their problems.
Oh, stress. Well, stress is a big one. Yeah, it's a beautiful thing. I think of so many different ways I would have liked to have had these solutions available earlier in my life, because I was a triathlete for a long time, training 6 days a week with constant pain and inflammation in my body. And we've got a formula that we developed with an herbologist that has about 10 different essential oils in it, plus CBD, and it's a roll-on, and it feels incredible on sore muscles. I also know this because I was in a bad car accident 5 years ago. So not only am I the business owner, I make the product, right? Because I was injured pretty severely. I had a traumatic brain injury. I had spinal damage in my neck and my low back. So I've had a series of different shots and other things, and a couple hundred visits to physical therapy and the chiropractor, and daily use of CBD to calm down the inflammation. Because when you're in a car accident, you're hurt, and then when they manipulate you at the doctor's office, they hurt you more.
Right.
So then you put CBD on, and it calms things down. So once again, it addresses that cycle, because usually when people are hurt, like me, I ended up getting fired from the hemp company that I worked at initially, as I was a director of sales, and I was hurt so badly that I couldn't come to the office for a few months because I was recovering with the concussion and the pain. And so stress builds up because you're not yourself, and you may or may not be working, and so it's not a cure-all, but one of the things is important for people to know. We are doing things actively and have done things to prove how the products work. We were part of a very large patient trial. It's the biggest one in the US ever held, 3,000 patients last year.
Wow.
In a controlled patient trial by Radical Science. So it's RADICLE, and you can Google that. It was called the ACEs study, and we were one of there were a number of companies involved, each supplying one product for their cohort. And so our cohort used a 2,500 milligram tincture. We wanted a simple product as a baseline to build it from, and so the results were phenomenal. We had a few hundred people taking our product. The main results were achieved in the first 7 days of use, and the result was the quality of life was measured as a 73% improvement after 7 days on average. Pain was down over 50% on average. Sleep was up over 45% on average. And that was on a very simple, relatively simple formula. Okay, it was just a straight CBD oil with some terpene, what we call a terpene amendment. So it has some compounds added that are designed to create relaxation and a feeling of calm. All right. So once again, I'll come back to terpenes because terpenes are important. Most people do not understand that when they get high from a cannabis product, THC is not the primary driver of that. It's actually the terpenes in the plant, because those compounds create the excitement in the brain or the psychoactive effect. So to give you some simple examples, Steve, I know you're in Arizona, but here in Colorado, there's evergreens right outside of our office. And the smell from the evergreen is a compound called pinene. And that's actually a compound we use in some of our products. And then the smell from your citrus, like a lemon smell, is actually called limonene. And we absolutely flavor products with limonene as well. And each of those compounds, there are many of them. There's one in our product called beta-caryophyllene and another one as well, but I won't go off in the tangent on it. They are extremely important in cannabis medicine because they are active ingredients that create desired effects in the body. And so we use them in our human products as well as our pet products. The same sort of methodology in terms of, let's say, calming or aiming at reducing inflammation in a pet. Same as the dog. Uh-oh. Did I lose you?
No.
Okay, so I have my chief strategy officer calling in. Apologies.
So, let me ask, it sounded like you had a little bit of a background in the industry before you started the company. Are you a chemist by trade, or how did you dig into the product side of?
No, I am not. I learned a lot of chemistry in metallurgy as a kid, working in my family's steel business, but I did not know. I other than mandatory science classes I think I struggled through physics in college. I really enjoyed biology and chemistry early on, but we thankfully have a chief science officer now named Michael Papayardo, who's fantastic, and he's an expert on formulation science and cannabinoids. So we're luckily graced by having him as an advisor now to our exploits. He's created drugs for Tylenol and Advil and other pharmaceutical companies, and is an expert on oral dissolvables and all the polymers used, and a very exotic science. So luckily, I don't have to do all the heavy lifting on that regard. But it's an exciting time because, like I said, we have the DNA-driven products, and then we're adding multivitamins and some other components to some of our products to make them even more beneficial on a daily basis.
I gotcha. So, the whole basis when you start the company, because a lot of businesses, when they start, the person who starts it has to be also the technician, the doer of everything.
Oh yeah, I did.
Was that you at the very beginning?
Oh, of course. Yeah. We began as a wholesale trading company, first selling bulk ingredients. And then I realized that in order for us to claim a stake in this industry, we really needed to build a brand with a value add. Because once again, like we talked about earlier, oil is a commodity. Whether it's petroleum oil or CBD oil, it's a commodity, and those commodities fluctuate. But a product that makes somebody sleep, that's gold, and that doesn't fluctuate every day, like something on a commodity market.
Right. Yeah, I think it's still one of the top 5 problems of all entrepreneurs, business owners out there.
Sleep.
If they get a good night's sleep, it's like amazing.
We have formulations that actually 100% help that. Here's the interesting thing that people need to understand. A lot of people try a CBD. First of all, the products are not created equally.
Right.
Okay. That's the first thing, because even though I'm talking about a simple tincture, a simple tincture is just like CBD oil and MCT, coconut oil as a carrier, right? Or hemp seed oil. But we're actually creating these products with multiple different terpenes, and we have essential oils and products, and we're using a lot of botanicals. Back to oh God, what was I just talking about? Commoditization, right? We needed to create the brand so that we could create solutions that help people, not just be the commodity. And even though that's still an important part of the business, our focus is really on creating solutions. We're a solution creating thing. And I did every job before, like you were alluding to, but now we have a bigger team. I have a strategy officer who helps with our direction. We have a science officer who helps stop me from doing crazy things. No, I'm just kidding.
The lab, basically.
No, I mean, look, we are in a very interesting space because we're trying to get products approved by governments. I mean, I'm fortunate that not only do I get to speak on podcasts, but I got to speak I've spoken at conferences in Colombia, Panama, and Mexico this fall, and in Panama, I get to meet with the government because they're just bringing out a new cannabis bill for the first time ever, and we have an opportunity to work with them, and worked with patient advocates and doctors there. And in Colombia, we got exposed to incredible advancements in the veterinary science world. So we're now part of that and helping them advance that industry. And in Mexico, once again, I got to meet with people at from the Ministry of Health, and the idea is to advance medicine around the world, and more, once again, more tailored products. Like we made a product for people with something called refractive epilepsy. That's a very tough. What's the right word? It's a strain of epilepsy or a type of epilepsy that typically the patients have tried all standard pharmaceutical means and not had success. So they're looking outside the regular pharma realm. And so that's we were very proud about that, making that product. And I don't know, our goal is to just continue down that path. We're supplying product for a clinical trial shortly on animals in Australia. And then we are once again another trial for humans there. And that, along with the radical science trial that we already did and other trials that we think will help, we're very much getting into the idea of converting pharmaceutical companies to do good.
Excellent.
or to do better.
Yeah.
To better for us. And it's not easy here in the States because we have lots of roadblocks. But in other parts of the world, we're able to actually work directly with the government and to create lower cost medicines for the people, which is a win.
It is. And it's amazing. It's like, I know different parts of the world are open up to different things. What do you see in this industry? What is the biggest roadblock for a company like yours? Or I know more and more states are opening up to recreational marijuana as well, which is a little different than what you're doing. But what is the biggest challenge right now in your industry? And say, we'll stay in the US and then the rest of the world.
I think the biggest challenge in the industry for us is in the US is educating the public. The problem, the problem from my perspective is that wind back the clock to 2016, one of our first products was a beautiful cucumber mint lotion that with CBD in it that smelled great, and we tried to open up distribution into some spas, and people had no idea what we were talking about. They didn't know what CBD was. Now you fast forward to 2022, you have CBD in some gas stations and some hair salons and let's see, even at the gun shop. I mean, it's
in everything.
Like, how does that make any sense? And what is the quality of those products, right? It's not, that is a problem, right? Because we're over here partnering with doctors that are doing high level clinicals in the US and in other countries, and literally making, like I told you about before, making products that are considered medicine. Yeah. And this is CBD too. Really, we're involved in cannabinoid science, and they're making recreational, a lot of these companies are making recreational whatever. Some of it's junk. The issue is that the states are all acting differently on this, even though there's something called the Farm Bill of 2014 and the Farm Bill of 2018, which said that all this is federally legal. There's no clear path because banking is still a pain in the neck for a lot of companies in the space, in the hemp space. It's allowed, but there's still wrinkles in it, and there are still extra charges granted to us for processing credit card transactions for clients, and there's still disdain from some sectors. For instance, like the main veterinary organizations are still not on board with all of this, even though we know for a fact that the products help the dogs and they don't have the horrible side effects that a lot of pharmaceuticals have. So I would say that's the most of the roadblocks. I didn't finish my thought about the CBD education. Now people see it everywhere and they think they know what it is, and they really don't know what it is, because cannabinoids are biphasic, and that's a science word. And biphasic means they work at both extremes or different extremes of dosing. So one of the big problems is people will try, let's say, a 25 milligram gummy, and then they'll try it once or twice and say it doesn't work for me. Okay. And then so the first question is, what was the reason you're taking it for, right? Are you taking it for wellness? Okay. You're not going to feel it because it's balancing your endocannabinoid system. It's nutrition that you might otherwise get from eating vegetables, because first of all, we have our own internal system that makes cannabinoids, okay? And we have receptors for these. We have endocannabinoid receptors. So our body is attuned for plant medicine. All right. So if you take one of our pills every day, it's like taking vitamins, and it's balancing your endocannabinoid system, and that affects your other systems. All right. So that's the first thing, education about that, because a lot of doctors coming out of medical school are not even trained on this, which is crazy. Second fact is that since it's biphasic, if you take 25 milligrams and you really want to take it to sleep and it doesn't help you, that doesn't mean it doesn't work. Maybe you actually need 65 milligrams to sleep. Or we have an inhaler, which I have one behind me, but I can't get it out of the case to show you. It's like an asthma inhaler that you puff. That actually has a 0.5 milligram of CBD in it, but it's water soluble CBD, and it goes straight into the lungs, and it affects people instantly.
Wow.
So the dose is tiny, but the effect is much larger. So in our trial I alluded to earlier with the radical science subjects, they were taking doses more than 83 milligrams, which is one dropper full on a 2,500 milligram dose in a 30 ml bottle. And it was very effective for them. And at the same time, I'm telling you, 0.5 milligram is effective for people. So that's why we talk about the biphasic nature of things. Okay, so as an example, with my car accident, I started experimenting with dosing very small doses of THC in addition to the CBD to get the pain relief. And I have found that with my own DNA testing, as an example, maximum my body really can tolerate is like a 1-to-1 ratio between CBD and THC. 1-to-1 actually in practice is too strong for me. I can go anywhere from 1-to-1 up to 20-to-1. So 4-to-1, 10-to-1, 20-to-1. My system doesn't accept the higher doses, but a small dose can definitely help with pain relief. On the other hand, I know people that will take 20 milligrams or 50 milligrams of Delta-9 and they're fine. My body would send me into, I would be in orbit for 7 days or more, probably. Probably have to someone would have to rescue me if I took a large dose like that. But everybody metabolizes cannabinoids differently. So what I take for me isn't going to necessarily work for you. So people have to take their time, experiment with product. They should find products that are lab tested and that shows what the full ingredients are and shows you a laboratory test. So as an example, how in-depth this gets, we do what's called a full panel test. We test for the cannabinoid strength, obviously. We test for, which is potency. We test for pesticides. We test for heavy metals. We test microbes. And then we don't do terpene tests all the time because we use isolated terpenes to put them into the formulas, but that's information that's needed. You want to make sure you're not having some pesticide put on the hemp field that comes into your gummies.
Right. Well, I know we're almost out of time here. What is one thing you'd like to let everyone know about your industry? Or, we just talked about the education part of it, but what's one thing you'd like to leave everyone with?
I think Americans should be open to plant medicine because it's been prolific in Southern Latin American cultures, as an example, and African cultures for centuries. And so drugs just didn't pop out of the air. They were made with, and there's still many of the drugs that we know that are prescribed on a regular basis are made from botanically derived ingredients. So there's plant matter in regular pharmaceuticals. People should not be afraid of well-crafted cannabinoid-based products that can help them solve issues with a natural ingredients and no horrible side effects. Okay. I think probably an important thing to add on to that is nobody's ever died from overdosing on cannabinoids or cannabis, right? You can overload your system and you can get way too high. That's not our products, right? But I'm just saying it's safe. We want to achieve something called GRAS, which is generally recognized as safe with the FDA. That's where we need to go with the industry.
Nice.
So thank you for having me. I hope this helps. We're open to questions at any time, on the phone or email.
Great. We're going to have Zev's contact information in the show notes so you can get a hold of Zev and check out all those products and see if there is one for you, and maybe even do that DNA and get something customized to you that really is going to change your life. I think that's a phenomenal idea.
Well, thank you, Steve. Pleasure.
Great. Well, thanks for being our guest and sharing your expertise. And if you like Zev and other experts on this show, please make sure you give us a positive review, subscribe to the channel, and like this episode. I'm Biz Coach Steve Feld, wishing you and your business much success.
We hope you liked today's guest on $1 billion marketing secrets over coffee. If you'd like to see how much hidden revenue we can uncover for you, well, click on the link in the show notes to speak with Steve. Mention the podcast when you book the meeting. You will receive a special gift. Make sure to like this episode and subscribe to this podcast to hear other great proven business leaders share their strategies to help you grow your business.